acceptance of COVID-19 vaccines is increasing, but challenges still remain with younger people who seem less likely to be accepting of vaccines than older people. Vaccine hesitancy has also declined from 33% between December 2020 and 6 January 2021 to 28% between the 25th of June and the 12th of July this year. Now, this is according to some of the key findings of the University of Johannesburg and the Human Sciences Research Council's COVID-19 Democracy Survey on vaccine acceptance and hesitancy. The survey also found that men were slightly more accepting than women, but slightly less likely to have been vaccinated. So to talk to us more about all of these findings, we are joined by Dr. Ben Roberts, who's a research director at the Human Sciences Research Council's Developmental, Capable and Ethical State Research Division. Dr. Roberts, thanks for your time. Welcome to Morning Live.
Yes, good morning and hello to the viewers.
Perhaps a good place to start would be to just quickly give us a brief synopsis of the survey findings.
Yes, so I think the main finding, the one that we're sort of reflecting on today, is issues around vaccine acceptance and hesitancy. And this was the fourth round of our survey, which was conducted between late June and mid-July. And what it found is that 72% of South African adults 18 years and above were willing to take a vaccine if offered to them, whereas 28% were not. Relative to the third round of late December, early January, where we found 67% hesitancy. So what we're seeing is an important increase relative to early in the year. And I think that's something that needs to be celebrated. But obviously, the fact that we still have 28% that are hesitant, it is something of a concern, particularly as the rollout progresses. And the findings that we've come up with are sort of broadly comparable to other surveys, such as NIDS-CRAMS and other key findings. So showing that there has been a slight increase in acceptance, but there is still a challenge that remains. And I think one of the important things that we're reflecting on as a team is the gap between acceptance and levels of vaccination. So we know that we're close to the 20% mark of adults being vaccinated. So if we see that 72% are willing to take a vaccine, there is a huge gap between the two. So it's reflecting on what might be the drivers of that and how as a country we might begin to address that gap.
And I was hoping to speak to that because the health department, as you know, have come out talking about men perhaps being slightly more hesitant. But your survey shows that men, while being slightly more accepting than women at 74% compared to 70% for women, they are more accepting of vaccines, but slightly less likely to have been vaccinated. So were you able to basically delve into that to find out what the cause is for it?
We have looked at that. It's a common finding not only to this round of surveying, but also the surveying that we did in December, January. And I think what we feel is the main explanation. It's not about specific. We've looked very much in depth at the kind of reasons South Africans provide for their hesitancy. So if we look at that by amongst men and women, we find there's not a huge disparity in the kind of underlying reasons. What seems to be an issue is actually more about health-seeking behaviour, and it's a general tendency that's been shown from a range of studies done in the country that men have a lower tendency towards health-seeking behaviour than women. So we think it's more likely to do with that than any particular standout reason for hesitancy amongst women versus men.
We also see that younger people are seemingly slightly more hesitant. What are the reasons for that?
Well, we've looked at quite in depth that there is quite a big difference. I mean, we find that it's about 55% of 18 to 24-year-olds are willing to take the vaccine compared to over 80% of those who are in the mid-50s and older. So there is a huge disparity, and I think that's particularly challenging as we move towards allowing 18 to 34-year-olds to be eligible to get their vaccination on the 1st of September or even earlier. And I think what we're seeing there is, if we look at the self-provided reasons for that hesitancy, it's not very different from the average public. It's issues particularly related to side effects, around perceived concerns over effectiveness of the vaccine, some element of distrust. But amongst young South Africans, we also find higher than average levels of uncertainty and a kind of wait and see attitude. So I think it's really about trying to provide young South Africans with the information that they might need to convince them to come forward and get the vaccination.
Dr. Roberts, I see vaccine acceptance also declined among white adults from 56% to 52%. Can we talk to that? Also looking at the black adult population, where it has increased the acceptancy from 69% to 75%.
Yeah, we do find a strong racial difference, as you've indicated, in levels of acceptance. And one of the most striking differences amongst white South Africans is a very strong concern of the effectiveness of vaccines, as well as a strong concern over side effects. It's more than 20% higher than the national average. So they have sort of deep-set concerns that really need to be addressed in ongoing communications campaigns. So there is that big disparity, and it's clear that it's remained over, certainly over successive rounds of surveying.
Also, religion. I see the report also speaks to that. But how is religion actually swaying people in terms of the choices they make to either be vaccinated or not?
I mean, there's been a big debate internationally about the role of religion in shaping preferences towards vaccines. And what we find in South Africa is actually the degree to which a person is religious or not actually doesn't have a big bearing on levels of acceptance towards vaccination. Even in the open-ended results, when we look at the self-provided reasons, issues of religious objection were mentioned by only about 2% of South African adults. So really, although there is a real concern that religion is playing a shaping role, the scientific evidence for that in South Africa is actually quite thin.
And Dr. Roberts, then there's of course the question of access. So willingness and access, what did your survey find in regard to these two?
Well, I think it's one of the real concerns that we have as a research team is issues of vaccination. And the concern is that we've seen in particular those who have medical aid, in particular, have almost double the vaccination rate of those that don't. And we're also seeing those that have access to a motor vehicle in their household have also tend to report higher than average vaccination rates. So it speaks to the issues, the broader issues of access that you've talked about, and it's something that we want to really reflect on. And there is a concern that privilege might shape levels of vaccination, which will promote further inequality in our society. So as the former Minister of Health said, we need to bring the vaccines to the people. And I think that's something that really has to be considered in as the rollout progresses, is not trying to get people to vaccine sites, but actually try and get the vaccines into communities. So more mobile forms of vaccination need to be rolled out in order to counteract these patterns that we're starting to see in our data.
And how important has the role of government's messaging been in getting people to either accept or be hesitant about taking a vaccine? Because if you look at the information that's put out and misinformation in some instances, just how important a factor is that in the take-up of the vaccine?
A couple of findings are quite striking. Firstly, I think is the fact that awareness of COVID-19 and also awareness of vaccines promotes a greater degree of acceptance. So the more knowledge people are getting, it actually tends to promote a willingness to take the COVID vaccine. So getting information to people through their preferred channel of information and in their language of preference is instrumentally important. Also, what we find is if people have a sense of the threat of COVID's been exaggerated, it tends to obviously diminish one's sense of acceptance. So it really is about getting the information in a continuous way and through people's preferred channels. We tend to find that conventional media, such as television, radio, etc., are by far the most preferred forms of communication. Issues such as social media, while it's becoming increasingly important for certain segments of the population, even amongst those that are regular users of social media, they still prefer TV and radio as their first choice for information related to the pandemic.
And I don't know whether this is a subject that you actually touched on in your survey, but people knowing of people who perhaps have had COVID, who became severely ill or may have died as a result of COVID-19. If this is a question that you pulsed in any way, what are people saying about that? Is that a factor in getting people to take up the vaccine more readily?
I think there's a couple of dimensions there. And personally knowing someone, within your circle of social contacts and family and friends, if you know someone that's been ill, etc., whether that has a bearing, probably not as strong as one might imagine. We have tested for that, although it does make some difference, but not to the scale one might envisage. I think what really matters perhaps more is seeing others within one circle come forward and take the vaccine. So whether that's leaders in one's community, whether it's people one looks up to more generally, and even members within one's network taking the vaccine seems to have a big effect on willingness to oneself come forward and take the jab.
And just finally, in terms of getting people to have a better understanding of what it is that they are dealing with in terms of COVID-19 and also the vaccines, what would you suggest needs to be improved upon?
I think the main thing now is the communications campaign. It needs to be very targeted. It needs to be continuous. It needs to speak to the preferences of specific segments of our society. And it needs to be, there's a real appeal for information and more information. We need to convert that uncertainty into a sense of, I now know enough, I feel confident enough to come forward and get the vaccination. So I think it's always more and more communication, not less. We're not saturated with information, we always need more as the science becomes available. That needs to be tailored, as I've mentioned already, around the particular preferences of adults in their own language. And it's an ongoing thing. And we do communicate with policymakers through our messaging to try and show the kind of messages South Africans provide themselves about what might convert their hesitancy towards acceptance.
Well, very interesting. And thanks so much for sharing those results with us. And that was Dr. Ben Roberts, Research Director at the Human Sciences Research Council's Developmental, Capable and Ethical State Research Division, talking to us about the key findings of the University of Johannesburg and the HSRC Council's COVID-19 Democracy Survey, COVID-19 Vaccine Acceptance and Hesitancy Study. So very interesting, some of those findings. And young people, would be interesting to hear from young people, in greater depth, perhaps, what the reasons are for the hesitancy.